Two medics in protective suits jumped out of a car in a street in Turkey's capital, Ankara, and hurried inside a building, one carrying medical equipment and the other paperwork. Some 15 minutes later, they sped off to their next appointment, one of nearly 6,000 teams deployed across the country to try to stem the coronavirus pandemic by tracking down the contacts of those found to have become infected. Turkey has seen a decline this week in the number of daily deaths and rates of infection since it started to grapple with COVID-19. Doctors credit the country's contact tracing efforts, along with Turks' largely voluntary adherence to lockdown measures, for the trend.
Since the household is on average 4 to 5 persons, with the workplace added in, there have been cases where we track 200 people at once. This way, by diagnosing them early, we prevent the persons at home and work from spreading it to others.
Around 5,800 teams of 2 or 3 medics had identified 468,390 people who have been in contact with coronavirus patients. Around 99% of those had been reached and were regularly monitored by health officials. In Ankara, a coordination centre oversees the field visits and follow-up calls by telephone. The two groups cooperate to identify, test and report cases across the city. Under the system, the teams are tasked with telling contacts of a COVID-19 sufferer to stay at home for 14 days, even if they do not have symptoms. Other teams are then instructed to call them daily to ensure compliance and check on their health. If they report symptoms, they get another visit to give a sample for testing in hospital. Turkey, with a population of 83 million, has been conducted more than 40,000 tests in recent days.